Clay Odell here for LateralTraumaPosition.org. This video demonstrates a technique to put a patient from a supine to a lateral trauma position on a scoop stretcher, which is also called an orthopedic stretcher, then transfer the patient to an ambulance cot. What we think works is to log roll the patient up and onto one half of the scoop. So we place half of the scoop on the patient's left side, about 3 or 4 inches out. That way the midline of the torso lying on their side is in the middle of the gap. Now you might choose to use a draw sheet. This is particularly helpful for some large patients who might get part of their body stuck when you try to pull the halves together. We think it's a pretty useful option. If you're going to use it, make sure to stuff it under the patient pretty thoroughly so you can grab it on the other side after the log roll. Next, proceed with the log roll in the usual manner, with the person holding C-spine calling the shots. Pull the drawstring through, then engage the halves of the scoop. Provide some equal lift on the drawstring if needed to get the ends together. Next, we're going to pad the patient's head to maintain spinal alignment. We've found 2.5 folded bath blankets provide the right level. Your experience may vary, and of course you may need to put more or less padding based on the size of your patient. We're now going to lift from the ends, and the person with his back to us has a job of providing some gentle support on the patient's torso and head to make sure they don't roll off the scoop. Yeah, that would be a rather bad form. So preferably the scoop is lifted straight up and the stretcher is slid underneath. If you have to move the patient any distance, they should certainly be adequately secured to the scoop. Next, we're going to separate the halves, which sometimes presents a little bit of an issue with this device. But once it's disengaged on both ends, someone controls the head, and consider using some equal tension on the draw sheet and smoothly pull the halves away simultaneously. At that point, you can let go of the head, you can tuck in the draw sheet, place some pillows for stabilization, and apply the stretcher straps, which we'll discuss that last part in another video.